So as I mentioned before, that the patient with end-stage renal disease may suffer from other systemic conditions, for example, hypertension, systemic lupus erythematosus, diabetes mellitus. So here we have to consult the physician to check whether the patient is controlled or not. For example, if the blood pressure is controlled or not, the level of the glucose in the blood, whether to control or not. So this is very important. Or even to check the patient, whether the patient may suffer from certain clinical manifestation of the end-stage renal disease. For example, if the patient anemic, if there is bleeding tendencies, or even if there is any shortness of breathing, any other clinical manifestation of the end-stage renal disease. So this is to check. This consultation is very important. If the patient is controlled, so in this case we can give dental treatment, and dental treatment can be given as outpatient basis. Outpatient basis, that means we can give dental treatment in the dental clinic. But if the patient is not controlled, that means there is elevation in the blood pressure, or the diabetic condition is not controlled, or there is another condition, so in this case it is better to avoid dental treatment. Also, certain conditions, for example, if the patient, for example, complained of severe toothache, and also there is swelling, so in this case we can, and the patient is not controlled, we can give dental care actually with caution in the hospital. So case of emergency condition, severe toothache, or there is swelling, so in this case, and the patient is not controlled, we can give dental care with caution, and it should be in the hospital. Now, if we want to perform certain surgical operations, for example, the simplest one, tooth extraction. In this case, any patient with end-stage renal disease should be checked, or the blood screening should be done. That means we have to check bleeding time, platelet count, hematocrit, and hemoglobin. Because as I mentioned before, the patient may suffer from bleeding tendencies, or the patient may be anemic. So in this case, hematocrit and hemoglobin may give indication or may give some idea about the anemic condition, or even the bleeding time and the platelet count, or even sometimes this may give some indication about the hemostatic mechanism actually, because even there is sometimes there is disturbances not even in the platelet count, but also in the function of the platelets and even the coagulation factors. Monitor blood pressure. Blood pressure should be monitored before appointment and during dental appointment. As I mentioned before, most of the patients with end-stage renal disease may suffer from increase or elevated in the blood pressure, because as I mentioned before, blood pressure or hypertension could be the cause of end-stage renal disease, or hypertension could be the complications of end-stage renal disease because of the kidneys lost their function. So in this case, fluid overload may lead to hypertension, or the hypertension could be because it affects the vasculature of the kidney, and this will lead to damage to nephrons, and this will lead to end-stage renal disease. So blood pressure should be checked. Good surgical technique, we have to avoid any traumatic surgical extraction or any operation to the soft tissue and bone as well. Avoid nephrotoxic drugs. Nephrotoxic drugs, actually this includes tetracycline, aminoglycosides, acyclovir, which is one of the antivirus, and also aspirin, and all the non-steroidal anti-inflammatory drugs, because actually all of these are nephrotoxic. So we have to avoid all these drugs. Even acetaminophen or paracetamol, actually this is nephrotoxic, but at high doses. So we can reduce the dose and decrease the effect on the nephrons. So acetaminophen or paracetamol, this is more safer, but it should be given as low doses. Valium and benzodiazepine can be given, and this is safe actually, but we have to avoid what we call central nervous system depression drugs. This is include barbiturates and narcotics, because the blood-brain barrier is not intact in case of patient with end-stage renal disease. So this may pass the blood-brain barrier and may lead to excessive sedation. For this reason, we have to avoid barbiturates and narcotics. Also, we have to avoid general anesthesia, because usually the patient may be anemic, so in this case, or decrease in the hemoglobin, so general anesthesia should be avoided, or even the patient may complain of shortness of breathing because respiratory system also affected by the disease process. So adjust drugs metabolized by the kidneys. For example, as I mentioned before, paracetamol can be given safe to the patient with end-stage renal disease, but at low doses. So to reduce the dose in order to not affect the nephrons or not cause destruction or damage to nephrons. So adjust the drugs that need to reduce the dose actually, or even the time given for the patient as well. Manage orofacial infection aggressively. As I mentioned before, the leukocyte might be, or the function of the leukocyte might be affected by the disease process. And also the immunity of the patient is not properly worked. So in this case, actually we have to give the patient antibiotics. But when the dentist decides to give the patient antibiotics, it's better to consult physician because some of these antibiotics might be nephrotoxic and affect the function of the kidney. So consultation also important. Severe infection, if the patient complained of severe infection, in this case it is better to be treated in the hospital, to consider hospitalization in order to control the severe infection. So this is the dental management of patient with end-stage renal disease and under conservative care. And in the next lecture, we are going to discuss dental management of patients with end-stage renal disease, but who under the dialysis, and particularly hemodialysis. So this is the end of the lecture, and thank you for your attention.